Thank you for your interest in Vet NeuroJar. Although we do our best to summarize veterinary articles, it does not supplement the actual article, and if you are able to download and review the article yourself, please see the link in the description. This will summarize the article titled Reliability and Interobserver Variability of a Grading System of Ventricular Distension in Dogs. Introduction. Internal hydrocephalus is a common central nervous system malformation in dogs, which can be treated with ventriculoperitoneal shunting (VPs). Research has identified surgical indications, intraventricular pressures, VPs complications, survival, and symptom improvement. However, there remains variation in surgical care and decision-making in veterinary medicine. Grading of ventricular distension can improve surgical techniques, prevent overshunting complications, and predict clinical outcomes. Currently, ventricular distension is mostly subjectively graded without standards across institutions. An objective and easy grading system with high reproducibility is necessary. Therefore, we propose a grading system for ventricular distension in dogs and assess its interobserver variability in this study. This grading system can benefit patient selection and tailoring appropriate treatment. A consistent classification of structural changes in hydrocephalic brains will allow for comparative research across veterinary institutions. Methods. The Department of Veterinary Clinical Sciences, Small Animal Clinic, Neurosurgery and Clinical Neurology at the Justus Liebig University in Germany conducted a retrospective study on magnetic resonance imaging (MRI) scans for dogs with diagnoses such as internal hydrocephalus, ventriculomegaly, dilated ventricles or without special findings. The study included sex, age, and weight of the dogs during the scan, and MRI images were analyzed by 3 reviewers. The research did not require approval from the ethics committee since it was a retrospective study of archived images and records that are not subject to ethical review. The study utilized a 1.5 Tesla high-field MRI scanner or a 3.0 Tesla high-field MRI scanner to generate sagittal, transverse, and dorsal T2 weighted images with a 3 mm slice thickness. The field of view varied depending on the dog size, with 180 x 180 mm for small dogs and 210 x 210 mm for large dogs. The matrix size was 288 x 288 pixels for small dogs and 384 x 384 pixels for large dogs, which produced an in-plane size of 0.625 x 0.625 mm to 0.54 x 0.54 mm. The MRI images were analyzed by a neurologist in training, a board-certified neurologist specializing in treating internal hydrocephalus, and a general practitioner with no MRI experience. The analysis involved measuring the degree of ventricular expansion at 2 landmarks and categorizing it into one of 5 grades, with grade 0 indicating normal lateral ventricles, and grade 5 being the most severe. The ventricle brain index was calculated by dividing the maximum continuous distance between the internal borders of the ventricles by the maximum width of the brain parenchyma in the same image, in which the lateral cerebral ventricles have the largest dimensions. The statistical analysis was conducted using SAS software package, and the results were assessed based on the grading system and a confidence level of 95%. The agreement between reviewers was assessed using Spearman and Kappa tests, and the correlation between grading data and VBI measurement was analyzed using Spearman's rank correlation. The study found that by using MRI images and grading systems, veterinarians can accurately diagnose and classify the severity of internal hydrocephalus in dogs. Results. This study examined 147 dogs, median age equals 24 months, range 168 months, median weight equals 8.6 kg, range 0.7 to 58 kg, of different breeds. Table 1, regarding their ventricular dimension grades. Intra-observer assessment showed strong correlation between the neurologist in training and board-certified neurologist. R equals 0.97. CL 95% 0.95 to 0.98. P 0.0001. And moderate correlation between the board-certified neurologist and general practitioner. R equals 0.91. CL 95% for 0.88 to 0.94, P 0.0001, figures 8 and 9. Interobserver agreement was excellent between the neurologist in training and board-certified neurologist and moderate between the board-certified neurologist and general practitioner. Table 2. Except for grades 2 and 3, the overall interobserver agreement was excellent. Table 2. A high correlation, R equals 0.94, CL 95% 0.92 to 0.96, P 0.0001, was found between increasing grades and increasing VBI for the most experienced observer, and 90% of the variance of the studied VBI could be explained by the observer's grading variance. F equals 305.67, P 0.0001. However, there was overlap in VBIs between different grades. Table 2. Discussion. This study introduces a novel classification system of 5 grades of ventricular distension in dogs and discusses its merits and limitations. The system demonstrated reliable consistency between experienced neurologists. However, grades 2 and 3 presented difficulty in differentiation. To simplify the grading system, visual assessment of the dimensions of the hippocampus and temporal horn was employed. The results indicate that observation of brain morphology and MRI interpretation experience are essential for accurate ventricular grading. The study highlights that treatment strategy for internal hydrocephalus is still evolving. It is important to identify the number of involved ventricles and the degree of distension to determine the outcome of VPs, as advanced ventricular distension increases the risk of hemispheric collapse and subdural hemorrhage. The authors suggest that a score predicting the success of VPs and potential complications and further treatment for hydrocephalus is required, for which the proposed grading scheme is a highly useful factor for defining ventricular dimensions. Overall, the assessment of ventricular dimensions suffers from subjectivity, particularly among brachycephalic dogs in contrast to mesocephalic breeds, which often exhibit ventricular enlargement referred to as ventriculomegaly. Such enlargement has been clinically classified as irrelevant. However, it has been observed that abnormal cerebrospinal fluid drainage from the enlarged lateral ventricles commonly seen in brachycephalic dogs results in white matter atrophy and reduced cerebral blood flow. Therefore, the authors propose the use of the presented grading system to avoid ventriculomegaly and instead perform an assessment of ventricular enlargement of different grades. By using standardized anatomical structures, the grading scheme avoids the effect of brachycephalic head shape variations on ventricular enlargement assessment and helps categorize ventricular size. The authors note that although the grading system is effective, further studies are required to test its correlation with clinical outcomes. There are a few limitations to this study. Firstly, there was only one observer in each of the 3 experience categories, which limits the evaluation of different experienced observers' reliability in using the grading system. Secondly, though there is an overlap between the grading system and the previously used Evans index, further studies are required to test their correlation with clinical outcomes and measure the consistency of correlation among multiple observers of different experience levels. Thirdly, the study did not analyze the relationship between ventricular enlargement and potential clinical symptoms or other MRI findings, which could limit the clinical relevance of the grading system. In summary, the proposed grading system shows potential in assessing ventricular enlargement objectively across different dog breeds. It could serve as a useful tool in determining treatment for internal hydrocephalus. Further studies are required to validate the grading system and its correlation with clinical outcomes.